PCOS is actually an acronym for polycystic ovarian syndrome. It is a condition that's a constellation of symptoms. So sometimes women have irregular periods, they can have signs of what we call hyperandrogenism, or things like acne or increased hair growth. And they also have ovaries that on ultrasound can have a certain shape and appearance. It's very important for the diagnosis of PCOS for you to have at least 2 out of 3 of those findings. And there are other tests that need to be done because it's truly a diagnosis of exclusion. There are things that, such as having high prolactin levels, that could masquerade as PCOS but actually be needing to be treated in a different way. The treatment greatly depends on what their goals are. I really try to divide people up between people who are actively seeking pregnancy or people not actively seeking pregnancy. If you're not actively seeking pregnancy, oftentimes either things like birth control pills or cyclic progesterone may be recommended, because those are going to help control your periods, keep your uterus healthy, decrease the risk of uterine cancer. And in the case of birth control pills, they're also going to help control symptoms like acne and increased hair growth. In patients who are seeking pregnancy, we often use either oral medications or oral and injectable medications to help them recruit a follicle, which they naturally aren't doing. When that follicle in their ovary grows, the egg is able to be matured and then released, and then ideally they're going to get pregnant.
And when someone's been diagnosed with PCOS, how typically does it long for them to conceive? Or it increases their chances, obviously.
It's very difficult for women with PCOS to conceive because they don't usually ovulate on a regular basis. So they may randomly ovulate, but timing is very, very difficult. When they're undergoing fertility treatments, usually conception happens relatively quickly. Women with PCOS might have a little bit higher risk of miscarriage. The things that we see most often are women with PCOS often have higher blood sugar levels, thus can have increased risk of getting gestational diabetes or diabetes in pregnancy, and complications with blood pressure like preeclampsia.